Good morning. My name is Adiba Pomerantz. I'm your moderator for today's program. And welcome to Online Forum presented by Communities Confronting Substance Abuse and Refa'enu. We are pleased to have three people here to talk about the issue of ADHD medications and substance use disorders and share their unique perspectives on this issue. I'd like to remind everyone to be respectful of each other's privacy, particularly when sharing personal stories. During the meeting, you may chat any questions you would like to address to our presenter, and time allowing, we'll get to as many as we can. This session is estimated to end at 11:05 we're going to do. And I will now throw the presentation over to Matisyahu Shulman, who will introduce our speakers as well.
Hi, everyone. Thanks for coming, joining us for this important topic. I'm Matisyahu Shulman. I'm an addiction psychiatrist. I work at New York State Psychiatric Institute and Columbia University Medical Center as a researcher, and I also have a clinical practice. I'd say I have quite a bit of clinical experience addressing substance use disorders and ADHD, and certainly with stimulants, I would have a lot to say, so hopefully we'll talk about it. And I'm joined by two, I say up-and-coming medical professionals, CJ Levin and Ellie Forman, who are both have some lived experience in terms of stimulants and ADHD. And part of the goal of the session is to try to think about as I think we should think about all medical decisions in a balanced way, where we sort of balance the risks and the benefits of each choice. So CJ and Ellie will sort of give two perspectives in terms of how stimulants have worked for them. I guess we'll go straight to CJ now. He's a medical student and was working as a research assistant where I work at New York State Psychiatric Institute. And I'll let him talk about his story. You got to take off your mute. You're on mute.
Oh man, I hate mute. So my name is CJ Levin. I am a medical student, first-year med student at Robert Wood Johnson Medical School. I spent a number of years working at New York State Psychiatric Institute. I spent the past few years working in the Substance Use Research Department of NYSPI, New York State Psychiatric, where I studied pretty much any addiction, substance use disorder you can think of under the sun, looking at the physiology of substance use disorder. And I'm also someone who has been diagnosed with ADHD since the age of 7 and has been on ADHD medication since then.
Thanks, CJ. Ellie Forman is our other presenter. She is you said a community liaison peer support. She's a peer support specialist at Strive, which is one of the excellent, I'd say one of the better programs in the area in terms of treating substance use disorders. And she will share her own personal perspective.
Hey guys, good morning. My job title is unnecessarily long. I'm the community liaison and peer recovery specialist at Strive Health, which is just a fancy way of saying that I'm somebody with lived experience in addiction and in recovery. And I kind of use that lived experience both as a tool to help clients, partake in real world recovery while at outpatient treatment in Strive, and also to do community outreach events or act as a liaison between people suffering with addiction and the general community and kind of be that bridge. And I'm also a master's student at UPenn studying public culture. And my experience with ADHD and stimulants is I was diagnosed later in life, well, not too later in life, but at age 17, I was diagnosed with ADHD and they prescribed me Adderall at the time to treat it. And at that time, I already had a history of alcohol abuse as well as an eating disorder. And for me, my personal experience, once I was prescribed the Adderalls, I began to abuse it because it had effects that I liked, such as appetite suppression, but also just the enhanced focus and productivity of it. And that was kind of what I want to say, the gateway into my harder drug use and the progression of my addiction. And yeah, and as of right now, though, I'm about 3 years in recovery from addiction from stimulants and opiates. And like I said, working at Strive Health, student, all that, still medicated for my ADHD, but no longer on stimulants.
Okay, so, and thank you, CJ and Ellie, for giving us your personal experience with stimulants. So, actually, before I start and go into my spiel, maybe I'll ask you both to go. Let's go back to you, and can I ask you both, because I think last session you both sort of talked about more specifics of how the ADHD and stimulants related to your functioning and sort of how you feel about them. Maybe give like everyone a perspective on that, a little more, a little more perspective, so people can understand, how these two fit together for you. I don't know who wants to go first. Let Ellie go first, and then we'll switch this. Let's CJ go second.
Yeah. So I had gone through most of my life like undiagnosed with ADHD, but I was a very rowdy in class and unfocused, and I did okay in school, but it was kind of when I got prescribed the stimulants originally for my ADHD, and I took it for the first time, and I remember just feeling like, oh, this is what I've been missing. Like I was able to sit down, be productive. I was able to focus for something for more, if there was a sound in the distance, I wouldn't lose focus and focus on whatever sound was going on. I was able to actually focus on what was in front of me for the first time. And yeah, and I was predisposed to developing a substance use disorder though. And obviously that's a whole nother topic of predispositions to substance use, or like, the genetic components or whatnot. And there's all these other co-occurring psychiatric diagnoses. But once I had found that, like, it was definitely effective for treating my ADHD. And that's why I don't want to say like stimulants are bad, but for me, because of my predisposition to develop like a substance use disorder, I took it and I was like, oh, this is great. I wonder what would happen if I took more of it. I'll probably be an even better version of myself. And I overtook it to continue to self-medicate. And then once that was no longer sustainable, I turned to other stimulants like cocaine, and started taking that. And again, it was for the same reason. It was to be a better version of myself, but it led down a path to like eventually, I was self-medicating with all sorts of substances. But yeah, and that was my experience.
Oh, thanks. That's great. That gives a little more color to for your story. CJ, what about you?
I got diagnosed pretty early. My dad looked at me and went, well, that is just a little version of me, and I definitely have ADHD, so we should work on that. So at the age of 7, they took me to a child psychiatrist / pediatrician, and they're like, yep, this kid's got ADHD. And they had me medicated pretty early off the bat. And from then on, my life just kind of progressed from there. I've been on stimulant medication ever since.
And what's your sort of experience with it? I mean, do you find that like whenever you take it, it's really like things are better, or what would you say? It's
kind of hard at this point. So I definitely function phenomenally better on them than off them. But so here's one thing that I didn't talk about in the last session is like a lot of people forget to take their medications. Like if you take daily medications, there's a good chance you'll forget them. You're never going to forget with stimulants, because withdrawal is a thing and you will feel it very quickly. In fact, I have not taken my stimulants this morning and I am feeling the withdrawal. I'm really tired. So you're never going to forget to take your stimulants. You're less focused, you're less productive. But even more, what's interesting is that a lot of people talk about ADHD as like as a disease of not being able to focus, but there's also the opposite issue, which is inability to pull back and unfocus on things. So I would often go down these rabbit holes of being hyper-focused on stuff, things that I didn't need to worry about, things that I didn't need to work on. And being able to allocate those attentional resources is something that the stimulant medications allow me to do. So I can not only focus, but I can stop myself from hyper-focusing on things as well. So it's pretty important. Oh, my fiance is very kind, and she has brought me, has heard my plea and has brought me my stimulant medications.
And realized
All right, that's a good.
it's going well.
Yeah.
Excellent. Okay. All right. Thanks. So thanks, CJ. That's good. I think that helps give a little more flavor. So a little more color to the story. Again, I'm Matisyahu Shulman. I'm an addiction psychiatrist. My job is to try to be like the clinical content expert in the session. So I just wanted to, before we open things up to discussion, I wanted to give a little bit of background information about when we keep talking about stimulants, what class do we mean? Are there other choices for ADHD? And then we can talk about some other things as well. So just on that topic first. So stimulants are a class of medicine that sort of increase the activity of the parts of the brain. That's why they're stimulating. They have the largest effect sizes for ADHD. They work actually better than almost any other psychiatric medicine. They work quite well. So they work really well in terms of addressing ADHD, but on the other hand, they are a controlled substance and they have the risk of someone can develop an addiction to them. They are sometimes reinforcing. Sometimes people will feel euphoric, will feel really good when they take them, and there's that risk of people overusing. So I see there's a question about Concerta, which is a great segue. Which is even so that's the class of stimulant medicine. There's another class of medicine which we can use to treat ADHD, which is non-stimulating. It's a non-stimulant. We don't call it non-stimulating, but it's a non-stimulant. It's not addictive. So there's no concern that someone will become addicted to them. There's no concern that someone will get euphoric when they take them. And examples would include Strattera, which is atomoxetine, which is a serotonergic and other. And I'm not going to go into the neurobiology, but it's a medicine which can be used to treat ADHD. It doesn't have the same strong effect as stimulants, but it is FDA approved for ADHD, so it works. And it's a choice to be used if someone's really worried about the addiction potential of stimulants. Other examples are clonidine or guanfacine, which are centrally acting medicines, which are also used for hypertension, for high blood pressure, but they decrease the arousal in the body and the brain. Another example would be Wellbutrin and bupropion, which is also dopaminergic medicine. It works, it's kind of like a stimulant light, but it certainly, people do not get high using that medicine. It doesn't have the risks, but it also doesn't have the benefits. So as intense of a benefit, I'd say. But actually last session, CJ and Ellie pointed out that everyone's different. Sometimes people actually on these other options will do better and feel better. So I shouldn't, just because I say the stimulants generally work better doesn't mean they always work better for everyone. So you have to see how things work for each person. Getting back to the stimulants. So within the stimulants, they're not all created equal in terms of risk. So someone asked about Concerta. Concerta is a long-acting form of Ritalin. Another example would be long-acting Adderall, Adderall XR, and those are both formulations of a stimulant medicine, which they're sort of, the pill is made in a way that it only releases in the body relatively slowly. That decreases the risk of someone developing an addiction because you don't get that big spike in the medicine in the brain that creates that really good feeling really fast. So those medicines are lower risk, and when they've done studies showing how people reported how much they like the medicine, so Concerta and long-acting Adderall are both pretty low on the list. An immediate release formulation, maybe someone said, "Oh, I really felt good when I took this," but those other options, they didn't necessarily feel, that strong effect. Another formulation I should just mention is for people that are also very worried about addiction is lisdexamfetamine. sort of a playoff of Adderall, but it has an extra molecule on it. So if a person takes that medicine, let's say they snort it or they take a lot of it at once, it doesn't become active in the body until the liver breaks it down. So it can only become active at a regular rate. So it's much less risk of someone abusing it. They wouldn't be able to really use it to get super high right away. People still overuse it, but it's certainly not the same risk as those other medicines. So that's another formulation that could be considered in cases where someone's worried about addiction. And maybe it's relatively expensive now, but maybe we should be using it as our first line treatment for everyone once it's cheaper, or if it's doable, because of that benefit that it's less risky. So those are that's an overview of the medication choices. And I would say, I think whenever there's a medical decision to be made on what medicine to choose, so people have to think, well, we have the risks of stimulants, which are maybe addiction and their side effects, versus the benefits, which maybe they work a little well, or we can expect them to work a little more strongly. So that's how I think about it. Do we have any questions, or I can keep talking about a different topic if there are no other questions? Anything else?
No other questions yet. So if anybody does have a question, please post it to the chat and we'll share it with the group.
Okay, so the next topic I wanted to talk about is the issue of having let's say a child or someone prescribed a stimulant medicine, how does that interact with the risk of them developing a substance problem? You might think, well, a stimulant is possible to abuse, and as Ellie mentioned, it's possible that it could even lead to more serious problems if it becomes overused and someone's used to overusing the medicine. So is that dangerous? Should I worry about that? Maybe I shouldn't have my child prescribed. If, let's say, I have a history of substance use disorder in my family or whatever it is, there's a concern about that, maybe I shouldn't use a stimulant. So so just to give a quick overview of the medical research. So there was a researcher about 20 years ago at Harvard that was doing the early research on this topic. And he came out on the side of saying that stimulants are associated with lower risk. If someone's prescribed a stimulant, there's a lower risk of them developing a substance problem. There were some questions about his methods and about his sort of being totally objective. Some people consider him a little bit controversial, but as time passed, people were able to do larger studies. Let's say in some of these Northern European countries, there are countries where they have every person in the whole country is in one database. So they looked at the entire country, they looked at everyone with ADHD, everyone who was on a stimulant, and everyone who wasn't, and they checked, well, who is more likely to develop a substance use disorder problem? And it seems that people that were prescribed stimulants had a lower risk of substance use disorder problems. Similarly, in America, they found there were some studies done where people that were prescribed stimulants had lower risk of going to the ED because of a substance problem. So the evidence seems to show that overall stimulants are helpful. It's help for people with ADHD to prevent a substance use disorder. Just to give you, I don't want to sort of take sides on controversial issues. I'm just sort of saying that there is evidence in the literature that seems to support the benefits for stimulants. I'm not saying that everyone has to be on a stimulant. I think you always have to take risk benefit, and there's also personal preferences. But certainly it's something that, shouldn't be. I'd say if you're worried about substance use disorder for someone who's younger, certainly you should err on the side of actually trying to treat more aggressively. So that's that topic. I see someone asked, could I spell some of the medicines? I think, and Vyvanse is actually the last medicine I mentioned earlier. It's lisdexamfetamine. Vyvanse is the brand name of that medicine. With regards to spelling the names, I don't want to be telling people specific medicines. I think you can go on Mayo Clinic or I think there's sort of a lot of literature on the web in terms of options, but I think the idea is longer acting medicines and pro-drug. Violence is called a pro-drug. Those would be the sort of the general direction of safe. Those would be the safer options for stimulants in terms of abuse potential.
Okay, I've got a question from the group. What if medication doesn't help an ADHD child who's currently in 8th grade that's been on it for 6 years? The child is also very impulsive and OCD.
Mm-hmm. Good question. See, yeah, how do you want to take a stab before I keep talking and talking, but
cognitive behavioral therapy on top of the ADHD medication would probably go a very long way. Also, if the child also has OCD, a common thing that's thrown into the mix with ADHD medication and the cognitive behavioral therapy is an SSRI called Lexapro, which one reason the ADHD medication and if there's therapy on top of that might not be working well is because the OCD, as I mentioned earlier, there's 2 states. There's focus and there's there's inattention, there's hyperfocus. OCD kind of shifts you towards the hyperfocus and makes it difficult to sort of dissociate from other tasks, and it makes it difficult to do the things you need to when combined with ADHD. It's a really weird mixture. My father has both of these, so I've witnessed this in people. So it's an interesting mix how it happens. But the combination of ADHD meds, OCD meds, and again, this one is really important, is cognitive behavioral therapy in conjunction with these is incredibly important as well.
Yeah, and I would actually add, I OCD is one of my areas of expertise that I treat a lot of. I think very important with anyone with OCD, I would just say to everyone, I repeat this again and again, is you have to really be careful to find a therapist that knows how to treat OCD, because there is a pattern, and I don't want to take too much time on it, but I think this is really important, so I'm going to say it. There's a pattern with OCD that the person gets an anxiety-producing thought or an impulse to do something, and the question is what you do with that thought. So the part of the disorder is that when there's that anxiety-producing thought, the disorder makes the person do a compulsion to make that feeling go away, and anything which is another compulsion, which is trying to make that anxiety go away, is actually making things worse. So if you have a therapist that will say to a person, I've had people come to me who are in terrible distress, not kids, but I don't treat anyone under 16 usually, but I've had adults come to me that are in terrible distress because they had a therapist that was telling them, well, you should keep telling yourself to relax, you're fine, you're safe. And that's actually the opposite of what you should be doing. That's more compulsions, is make things, that just recreates that cycle in the brain of trying to push down the anxiety. Very important to find someone who can explain the idea of an exposure where you sort of allow yourself to feel anxiety, allow yourself to accept the uncertainty of situations, not in an aggressive way, but in a measured way without being overwhelmed, but exposing yourself to anxiety. So anyway, in this case, for example, where you see someone's not doing well and you've tried a lot of different medicines, I find it's often because you're not really getting at the OCD appropriately in therapy. So that I don't know about the case, maybe there are other medicine options. There's always usually more medicines that can be tweaked or tried, but certainly I agree with CJ, it's very important to try to find the right sort of mindfully based and exposure based therapist rather than just a general therapist that might be providing. With OCD in particular, you have to be careful that you might be actually getting things that are making things worse in therapy. So that's my take on that. Are there other questions or?
No other questions just yet. So if you want to talk about some other things we may have talked in the last session, and if people would have any questions, please post and I'll share with the group.
So I think the last topic that I just wanted to cover, if we're talking, is the risks of stimulants, some of the downsides, and I think last time actually, if we have time, we'll talk about also how ADHD may be associated with substance use disorder. But with regards to stimulants, I think I wanted to acknowledge that they are addictive. We have to be careful with them. So some of the things that a family member can do, or let's say a support person can do, is one, try to be in touch with the medical provider if you're concerned. On Friday, I had someone who let me know, I have a patient who has ADHD but is working, and I really don't want to take them off their stimulant because I'm worried they'll lose their job. So I got the family member called me and told me that they think that this person is overusing the stimulant. And I really appreciated it because I would have no idea. You know, I think providers, sometimes people think doctors will be able to figure things out. You know, we can only work with what we have in front of us. So it's really helpful to let provider know if you're worried that the person's overusing, if you have concerns. It will help watch things more closely. You know, there's lots of things I can do. I can switch the formulation. I can write a prescription that's only 7 days. So there's less room for overusing. I can ask sometimes I'll ask family members to hold the medicine and only give it out one at a time. So I think we should, you know, with stimulants, they're powerful. You have to be careful with them. And so those are sort of all things that people can do to try to help, you know, make sure that they aren't overused. So then I think the last topic I want to talk about, and maybe I'll let CJ and Ellie just say what their opinions are on this, is sort of not about stimulants, but more about ADHD in general and the risk of substance use disorder and how they interact. Because someone asked about it last session, I think it's important to talk about. Ellie, you mentioned something, you told your perspective, so maybe you start and then CJ can say what his thoughts on it.
Yeah, so no, and I think last session I was talking about it a little bit too, that you know, with the ADHD, it made me feel like a subpar version of myself, I guess. And something that CJ mentioned too, the hyper focus, it was like I would either be really drawn into things or I would not be able to focus. A lot of times when I'd be trying to do schoolwork in high school, and then I would hear like a sound come from downstairs in the kitchen, you know, all of a sudden, like I would be curious what that sound was. And and like more so than I think like a neurotypical person, it was like every little thing would like pull me away, or I would get super drawn into things. So when I finally got prescribed the Adderall, I think for me it was kind of, and I kind of talked about it earlier too, it was kind of like a solution to my diagnosis. And then I think a lot of times like in terms of like the ADHD and the substance use, I was primarily using substances at the beginning to be able to be a better version of myself. You know, even the cocaine, which came after the Adderall, and after the Adderall was no longer sustainable and my psychiatrist was no longer prescribing the amount I felt I needed, you know, that again was a way to self-medicate. And I think any co-occurring disorder, any co-occurring psychiatric diagnosis puts you at risk for a substance use disorder. And a lot of times that is because it's the self-medicating aspect of the substances. And yeah, and also just to touch on what you said also about the prescriber keeping an eye on things. Some warning signs that I was partaking in that maybe my prescriber should have been aware of was, you know, once I got prescribed the Adderall, I began pressuring my psychiatrist to give me higher doses, you know, without being on the original dose for that long, just because I felt how much better it made me. I started talking about how I didn't feel like it was enough. I couldn't focus still. And rather than like looking into necessarily like the validity of my claims, you know, my psychiatrist just kind of gave me more because I wanted more. So I started, you know, on 50 milligrams and it went up to 45, like within a couple of months, which should not have probably happened. In addition to that also, you know, I would talk about, like at one point I told my psychiatrist I ran out, you know, I need more, I must have taken too much or lost some of it. And like my psychiatrist didn't keep a close eye on necessarily what I was doing and didn't realize the problems that were developing. And just, I don't know if that's helpful, but it was just like some warning signs of like that a substance use problem is starting, is that, you know, pressuring for more medication or running out too soon, or just, you know, claiming that the medication isn't working when I didn't necessarily give it the chance to work. You know, I just was like, oh, this feels good. I feel like a better version of myself. And I just continued taking it. And that was kind of my perspective on how the ADHD played into my substance use disorder. And then I'll let CJ talk about, you know, his positive experiences with ADHD and
Or,
stimulants. And
or what you're, I don't know, do you have thoughts about how ADHD could relate to substance? I mean, I think there's certainly medical evidence that ADHD is associated with substance use disorder, as are most psychiatric diagnoses, but ADHD happens to be particularly associated. So, yeah, do you have any thoughts, CJ? Yeah, to take off your mute again.
There's a pediatric psychiatry research, Tom something, who does a ton of this research on ADHD and its risk for developing, your risk for developing substance use disorder, and it's absurdly high, particularly in unmedicated people. But with my experience with ADHD medications, I started medications when I was young, and I switched early on very rapidly from medication to medication as I started to develop tolerances to them. And instead of increasing my dose, they would switch me to different medications until eventually I settled on extended release Focalin, which just for some reason I never really developed a tolerance to, or at least a significant tolerance to, where I had to drastically change my dose. So from there, I was just maintained on that for a very large portion of my life. And I've been pretty consistent with just sort of ensuring that my managing my medications, talking with my prescriber, basically saying like, hey, here's what I'm feeling, I think we should go up, or hey, here's what I'm saying, I think we should go down, which has also been another conversation. There are times in your life, like when I was at my peak in college, like I needed the full dose that I would normally take. But like during the summer, when I wasn't working as hard or doing as many things, like there's no reason not to drop your dose, because while you may have a bunch of obligations, to be focused enough to drive is different from being functional enough to like be working a full-time job and stuff. So it's all like, you'll talk about taking meds off on the weekends. I generally don't do that because of just my schedule. But if you don't have an obligation on the weekend, there's no reason to not take the meds. And knowing when you can cycle down and cycle back up is really important and requires a lot of communication with your prescriber and your physician. And if you have that, I think it really adds to the longevity and success of these medications.
Okay, thanks, CJ. So I think, and I think that, I think from the sort of psychiatric perspective, when we think about ADHD and substance use disorder, I would say there's probably at least two things that may be going on. But sort of on a simple level, one may be the brain, some of the neurophysiologic functions the brain does. So the brain helps us take a step back before we make a decision. Let's say, look before we leap. So people with ADHD may be more likely to just jump into things, and that may lead to the risk of developing a problem. And then at the same time, there may also be some sort of psychological and sociological things. People that maybe are having more trouble in school, or let's say if we have untreated ADHD, they're really not doing well. They feel isolated. Maybe they don't have so many friends. That can lead to feeling like you maybe being part of a group where substances are being used, and also the need to use substances because of sort of to just help to feel better, because you don't feel right. Nothing's making you feel good in terms of school isn't going well, maybe your friends aren't going well. So those are all things that could contribute to one path, the substance use disorder. There are a lot of different ways that people develop an issue. Okay, so are there any other questions? I think we have a few.
There was a question. Does the age of a person, does the age that one starts taking the medication make a difference if they'll develop a substance abuse disorder later on, or issue later on?
I think CJ, what do you know about this topic? I think that the evidence is that probably starting younger is better. I think that evidence is that people that their ADHD is treated relative earlier on rather than waiting till like age 17, where it might be.
Yeah, there's a curve for it, basically showing like your at a population level, the risk of developing substance use disorder as a function of starting later and later, and your risk jumps up dramatically higher the later you start stimulant medication.
Which may be, I mean, there may be some artifact that may not be like totally because of the.
Oh yeah, you can't establish causality from that curve.
Yeah, I can do, but there's certainly, I think the takeaway is if someone is younger, if someone is 8, 9, 10, and really struggling in school, and it's clear they have ADHD, and let's say maybe they're having trouble making friends, I think it's important to try to have an earlier intervention to try to help the person. If the medicine will help them function better, you have to do it carefully and in a careful way, but it's certainly worth doing. Same way we find with, say, early intervention with speech or OT, that helping, trying to sort of catch people up and get them up to where they should be as early as possible really has a benefit far along the line. I think that's the same thing with stimulants, or with treating ADHD, I should say, not stimulants, treating ADHD.
Any other questions? Please post and we'll share.
Okay, so it seems like everyone has heard what they need to hear today. Everyone's tired from a long day of learning. But thank you so much to Eva, CJ, Ellie, and for everyone for coming. I think I said last time, if people reach out, I'm happy to answer questions. If they're not too clinical via email, or if you send them to the Formans, they can pass them on to me. That's it.
I'll just wrap up by saying thank you so much to Matis, to Ellie, to CJ for sharing your stories and your information, your knowledge. All the recordings, all 6 sessions from today have been recorded, and they will be on the CCSA website. I've given you the website address and also for Refa'enu in the chat. Thank you all for joining us this morning, and have a great day, and a Chodesh Tov to everybody as well.